Hello, guys. You're welcome to our channel once again. This is Vic.
And my name is Debbie.
So, welcome to Debbie and Vic YouTube channel, where we keep providing quality content related to love, related to marriage, faith and lifestyle. So, you're welcome. Thanks for watching and thanks for coming today.
For liking our videos. Thank you for subscribing. And if you have not subscribed, we would want you to be part of our family. And please just press the subscribe button here. Don't be a strong head, don't be a coconut headed person. Click the button now. Thank you. We love you.
Thank you. So today we want to discuss another topic. We always come up with very wonderful topics and practical one for that matter. Today we want to look at the subject matter of birth control methods for newlyweds. All right, birth control methods for newlyweds. We want to look at the question around when should we give birth? How do I prevent pregnancy on my wedding night? It's quite amazing, babe, where you meet people that say, and I didn't want to get pregnant too. I didn't want to get pregnant on that night. In fact, I never knew how the thing happened. Before I know I'm just pregnant. And then you'll be wondering that, what do you expect now if you if you didn't put any measure in place? It will automatically get pregnant. It will happen. I've seen and interacted with a few young couples. In fact, I just noticed that I'm pregnant in just 1 week or 2 weeks or 3. I say, and they'll be like, but it's not what we planned, though. We didn't really plan for it.
We wanted to wait a little while before getting pregnant. And this question too, we have that same question too when we wanted to get married. It is tricky because for someone like us that we were not having sex before the wedding, I was like, so we'll get married and then we'll get pregnant and then you start another new phase of your marriage entirely. So I feel like it is good to first of all take a little time personally to adjust to each other, being in each other's company, understand each other before you now start, because pregnancy changes a woman, changes your body, changes so many things about you that you can't take back. It is amazing, don't get me wrong, it is an amazing journey, but it is a phase, another phase of life nonetheless. So I feel like people should be, if you're saying, oh, I don't want to get pregnant, some want to get pregnant,
so that is it. If that's what you want, please, it's a very good one. Just go for it. It's all about plans and then what you and your partner want. Let me just chip this in before we move into the some of the methods we want to talk about. Also, is that don't be put under coercion to want to get pregnant. All right.
Start having babies.
Yes,
immediately after your wedding.
Especially families. For example, I remember on the day of our wedding, my mom was trying to pray. And my mom said, my mom prayed, and my mom was like, on the wedding night, that night of the wedding, he said you will receive it, you get pregnant.
And
I was just laughing, and I was like, what is mom saying? So, but my mom is not putting any pressure on me for anything. At least she has grandchildren already. But but what I'm just trying to say is that for some, they are put under coercion by families. And sometimes you want to just do it because of your family, not really because you felt that you guys are ready for it. All right. It's a new phase. It involves some finance. It involves some planning, so you also need to look at that. Are you both ready? One might be schooling. One might be doing one other thing or the other. Do you want to wait for a while? Good. If you want to wait, beautiful. But if you feel that you want to go into it and you just want to have it, it's also fantastic. It's all about what both of you decide to do.
And I would like to ship it in that marriage is more about companionship. You have to first of all have that at the back of your mind. Because I used to ask that, okay, what if there's no children in marriage? What will you still stay with your partner? You have to ask that question.
We're not praying for that. Fruitfulness digress is part of the promises of the scripture. But we are just saying, in a situation where there is a delay or something, if all you've been thinking about is to have children, that's the whole essence why you are trying to get married. I mean, we're just trying to say, what if something happened?
Will you still stay with your partner? You have to have that discussion. Yes. I think that it's something I always want to talk about. That okay, so what if there's no children in your marriage? Will you still stay with them, or there's a delay? Will you still stay with them? So I feel like marriage is more about companionship, being friends with each other and all of that. Babies are good, babies are really, really nice, but at some point, even when the babies leave you, it will still be you and your partner, your husband. So you have to build that bond, because some people, immediately they have children, the wife would automatically carry all our attention and put it on the child, because it's a newborn, and then a baby sometimes changes the life of some couples forever. Right?
Yeah. So let's just move straight into some of the birth control method. Listen, we are not health practitioners, we are not doctors, so I need to put that disclaimer out there.
First-hand information.
Yeah, but at least
we went to the clinic
during our own process of trying to learn about some of these things, we quite learned a few things, and we felt that these are things that we can also share with people, with especially the newlyweds, and then they can learn one thing or the other from
make informed decisions
if they want to or not. But remember, as we say, that don't let anybody force you. If it's what you want to do, just ensure that between you and your partner is what you want to do, and then just agree. So one of the first things, the first method we were told about and we learned about is pills. Yes. They are like tablets.
Yeah.
And I heard you, and they said you have to take it daily.
Yes, every day. You have to take it at a particular time.
Yeah.
Every day. So I think that the way it works, it alters the body, the chemical. I don't know. Don't let me even talk about the intricacies. You just have to take the pills at a particular time, and then when you want to start giving birth, maybe you decide that we want to wait for a month before we get pregnant, or we want to wait for 2 months before we get pregnant. It is not long term, so you can stop it at any time and then start having children. But you know that the nurse told us something when we went there. She was like, it is not good for a newlywed to go for that pills method. Was that?
No, I think it's injections that she didn't. Yeah, so for the pills.
Oh, yes, she recommended the pills.
Yeah, for the pills, one of the things around it is discipline.
You have to take it
how many people are disciplined that they have to take one drug each time at a particular time, that kind of thing.
And if you miss a day, you are altering the effectiveness.
And anything can happen. I don't know, it depends on what you want. If that's what you want, good, but personally, I feel that it's not a sustainable method, except you are that very disciplined to be taking drugs every day at a specific time. And for some people, they don't even like drugs at all. So if you are one of those people, that might not be a good method for you. But if you want it, good. But as we say, it's after listening to this, when you decide on what to do, it's still good to go to the hospital. They have this public family planning unit in most of these government hospitals. I say
maybe
government
your
hospitals.
Local. I keep saying local because the health center most of the times have that.
Most of these general hospitals are not that. If you go there, they have family. But when we say local, it begins to be like maybe it's in the village or something like that.
Just all the public hospitals
hospitals. A few private hospitals do it, but they have license. There are not too many.
And then they will be charging you a lot compared to going to a public health center hospital where they would probably be giving you for free. And then another one is injections. They sell it every 3 months, so it's something that can be taken. But that was the one the woman was saying that
so she didn't really recommend. She was like sometimes have side effects, sometimes bleeding.
So that person will get fat too.
Maybe weight and some other. But I think also we also need to mention that most of them generally, when having this discussion with, because we met with like two different ones, to hear from two different family planning and counselors. They spoke about the whole adding weight stuff, that it can happen in almost all of them. But it depends on your feeding and certain lifestyle.
It's based on the behavioral attitude of the individual involved. For example, some people will say, oh, it is this family planning I'm on that made me add weight. But you've been eating, you've been eating a lot since you got married. So it might be normal for you to add weight. So the whatever you are on might now be like helping you like increase the rate
the trigger
eat. Yeah, it's my trigger you and make you want to eat more, but it is up to you. It is what you put in that will add the weight. It's not
so it be literally a bit of discipline. It's needed, but there's possibility of some of them making you to. That is the truth. They told us that, but it depends on your body. Some people naturally have fat in their body too.
They eat everything in this life. They
you understand?
So I think that it is also an individual thing. So, and then there's something called implanto or whatever it is. They usually put it under the arm, like this,
somewhere here. Most time, maybe it's just your spouse that might know. Most people won't know because
people will not know because they insert it under the skin. It is a very painless process because they are going to use what's this thing, anesthetic or something, whatever it is that will not make you feel the pain, and then in like 7 days it will be ready. So the tricky part for this implant is that it does not start working until 7 days. So let's say you are getting married next week and you want to use implants, you have to have inserted it before you start having sex, because if you have sex between
at least 7 days before your wedding night,
so that you will not get pregnant that time. And the beautiful thing about that implant is that you can remove it anytime. They have two types. One is for 3 years and another is for 5 years. But you can remove it anytime. You can remove it 1 month after. You can remove it.
So just to add to that, if you are looking for, like, of course, for newlywed, advisably you go for like 3 years, right?
And then remove it
anytime after 6 months, 3 months, you can decide to remove it. But of course, if you are looking at child spacing, you might want to start thinking of like 5 years. That's what that one is meant for. That maybe you can space your. But of course, you can use 3 years if you feel your child spacing is between 2 to 3 years. You can go for that.
One thing about that implant, so I did research too by watching other YouTube videos and listening from other women's experiences. Most of the time, it has no impact on the body, in that you can remove it and immediately get pregnant, maybe 1 month after. And then also there are side effects to bleeding. Some people will bleed, will be spotting like all through the month. Some people will have heavy menstruation, or some will not have at all. So for people it depends on the woman and her body. What's like so they said that if you keep bleeding for so long and it's too heavy, then they might have to remove the implant from the person's body.
So that's why normally when it's done, they get your details. And they expect you to come back after a month or so to come and see them.
So that means your body did not agree with it. And then there's something called IUDs. I'm not sure IUD can work for somebody that is not sexually active.
For somebody that's getting married as a virgin, that might not work for you because it involves insertion.
So that might not work for you. But those are the 4 methods that
those are the 4 methods I think we learned about, which we feel that you can also number 5, there's still one, the condom. The condom. They also talk to you about the condom. In fact, they will give you some themselves. They will give you the ones you can start with, and then you can buy. There are different varieties of condom. I think you just need to explore on which one we get to work for you. Some people will not like it. Some people don't even like condom at all. Yeah, to
so
it. For some
whatever
ladies, it
works
itch
for
them.
you,
Yeah.
you just try it out. If it works, fine. If it doesn't, just discard it. You don't have to. And then
yeah, so then we have some natural method also that we learned during that time.
yeah.
And then I mean, you can also want to consider one of these natural method apart from the ones they were listed already. One of them is withdrawal method.
Yeah.
Of course, back by history, by research, our forefathers a lot of times.
It was mentioned in the Bible now. This guy, they married his brother's wife,
and he had to.
Testament. What's his name? He should have the name.
Yeah. So I've forgotten the name too now. Forgotten the name.
Can't is a very
So he had to use withdrawal method. So withdrawal method is an ancient method. It's still effective, but the truth is that a bit of discipline is needed on the part of the man when it comes to withdrawal method. Let's say a guy that has not been very sexually active before, the possibility of him being that strong in a way that he will be able to control himself, and pull out in due time might be tough.
Well,
I don't know. So
anything
is possible. Some people, some guys can actually do that. But as much as is also one of the method to keep it safe, some people use condom along with it if it possibly can. That is at the time where it's not they are not in safe period, which will also come to that. That is the second point. She will talk about that. But some guys use condom as a supportive measure at that time, and the time where they know that it's not really, they can do like that without not withdrawal or anything. But it's a good method, but as I said, it takes a bit of control. It takes a bit of discipline. It's normal as a guy when that you are in the heat of that. You get what I'm saying? If you don't get it, then forget about it. But what I'm saying is that when you are in the heat of that, you understand.
God will help you.
So you know that at that time it might not be too easy to to control yourself off like that. But people do it. As I said, it's an ancient method. Our forefathers have been doing it, so I don't know. So it's possible.
Something that you can do.
A lot of people use that, and it's working effectively for them. So you can also consider that.
And then
next natural method.
The next one is for women is to calculate your safe period to know when you can have sex without getting pregnant. People that want to get pregnant to use that safe period to calculate their fertile period to know when they can have sex and actually get pregnant. So it involves monitoring your menstrual cycle. And the truth is that if you are getting married next month, you can't start monitoring your menstrual cycle now. So it's something you should be doing even before you get married. There are some people that it is when they want to get married that they start saying, oh, let me start even looking at this thing. No, you should start monitoring it so that even when you want to even fix your wedding date, you can fix it on your safe period.
That can work. I'm not saying there are some churches that for a church like Deeper Life, for example. No, I'm not dragging your church. I'm just saying that they have most of them will say if
this month does not follow your safe period, next month.
So no. See, this is what I will say, just a suggestion, because that might be tough to do. I will say that if your calculation, maybe it falls during a time that is not safe and your wedding night falls in, because it is going to be tough saying that, calculating it, and then you can think of withdrawal method, or possibly you can think of condoms. That's if you are not going for any of the method listed earlier that
because
we said you should go.
Skeptical that I'm just a newly married couple and we don't want to make decisions like
you get it.
Family planning. You can do that. And then one important app as a woman, you can download my calendar on on Play Store, and then start imputing your dates as they're coming, so that at some point the calendar will even start predicting when you're supposed to expect your menses, and it will be right, because you already know
based
what
on
your
the
cycle
data you've been
is
feeling
like.
in.
Yes. So if you track your cycle for like 3 months or 6 months, you can have an idea of when your safe periods are, and that is when you are not ovulating, because ovulation is when eggs have been released to your body that can turn to pregnancy. So I think that is all for today.
Yeah.
Thank you so much.
So thank you so much for watching.
Would like to hear your thoughts too
around this. We can also learn from you.
What have you been doing to not get pregnant immediately after the wedding, or do you want to get pregnant immediately after your wedding, or why would you not want to? Just let's hear from you, and don't forget to use the subscribe button.
All right, thank you so much for your time. We love you, and we hope you've learned from this. So keep watching, keep sharing.
Don't forget to give us
let's hear from you. All right, yeah, and we would love to also have suggestions on topics also you think we can talk about. For some people that have made comment, don't worry, we are still going to cover your topic soon. Thank you.